So now let's move on to the etiology of carcinogenesis. So under etiology of carcinogenesis, we have chemical carcinogenesis, microbial carcinogenesis. Okay. So under chemical carcinogenesis, we have two phases. So any chemical can either directly act or it can be converted into a active metabolite which can then cause the disease. Okay, so we have two phases in the development of chemical carcinogenesis. First will be an initiation phase and next will be a promotion phase. So this initiation phase is going to be an irreversible phase because this is the phase in which they are going to acquire permanent damages, which is the mutation. So some chemical is going to initiate, but it is going to cause the mutation. Okay, so sufficient dose of the carcinogen is given, so it is going to initiate the process by causing mutation. Okay, while in promotion, it is a reversible stage. As such, the promoting agents are not carcinogens themselves, they are just helpers in the in promoting the cancer. So there is an already initiated or a mutated cell now. So these promoters are now going to act on this cell and help in becoming a full-blown cancer. Okay, so these are reversible actually. So they are not tumorigenic themselves, but they induce cancer to arise from this initiated or the mutated cells. So examples of this initiation will be direct carcinogens and indirect carcinogens. So direct carcinogen is the one without any conversion, they are directly carcinogenic. So the examples of this is chemotherapeutic agents like alkylating agents, cyclophosphamide. Okay, so these are alkylating agents, they are directly carcinogenic. Indirect acting carcinogens are, they are going to undergo metabolism, then the metabolite, which is the active metabolite, is the one which is going to cause the cancer. So the examples of this will be benzopyrins, polycyclic aromatic hydrocarbons, nitrosamines and aflatoxins. So most of this we read are indirect carcinogens. So all of these are going to cause indirect carcinogenesis. So promotion, what are the examples? So there is already a mutated cell. So on that I am going to put excess estrogen. So there is going to be some kind of pathology in which there is excess estrogen is there. So unopposed estrogen is going to result in the formation of breast cancer and also endometrial cancer. So estrogen is as such not carcinogenic, but on a mutated cell if it acts, it is going to promote the cancer. Same goes for chronic inflammation. So chronic inflammation, repeatedly there is chronic inflammation, it is going to result in cancers. Especially we saw it in marginal zone lymphoma, in Sjogren's syndrome, and H. pylori induced cancer, maltomas and gastric adenocarcinomas. So all of this chronic inflammation, even hepatocellular carcinoma in the background of hepatitis. So all of this, it is the chronic inflammation which is then promoting the cancer. Okay, so there is another MCQ key here. The test used for identifying the mutagenicity of a chemical is the Ames test. So Ames test is used for identifying the mutagenicity of the chemical, and here it is based on the growth of a bacterium which is Salmonella typhimurium. So based on the growth of the Salmonella typhimurium, they are going to detect the mutagenicity of the chemical in this Ames test. So we'll see about some of the chemical carcinogens and the cancers induced by them. In fact, in NEET 2022, this question was asked. One of these questions was asked. So aromatic amines like naphthylamines and benzidine. So these are going to result in bladder cancer. While asbestos, we have already seen, it is going to result in the lung cancer, lung adenocarcinomas, mesotheliomas, stomach, colon and laryngeal cancer. So it is going to cause both lung adenocarcinoma and mesothelioma. Mesothelioma is more specific, but lung adenocarcinoma is much more common. Okay, so asbestos for both lung adeno and mesothelioma. Apart from that, stomach, laryngeal and colon cancer as well. Then unopposed androgen is going to form prostate cancer. Unopposed estrogen is going to cause breast and endometrial cancer. So benzene is going to cause AML, acute myeloid leukemia. Then diethyl stilbestrol, which is having an in utero exposure. So when a mother is pregnant and she has been exposed to DES, the unborn child, if it is a female, the child is going to have a clear cell carcinoma involving the female genital tract. Okay, clear cell carcinoma in the female child. Okay. Alcohol can have multiple cancers, especially hepatocellular cancer, oral cancers, esophageal and laryngeal cancers. tobacco, again oral cancer, lung cancer, and then kidney cancers also, along with that laryngeal cancer. So tobacco is a very important risk factor for kidney cancer as well. Then vinyl chloride, thorotrast, and arsenic again for angiosarcoma of the liver. And arsenic as such, it can cause skin cancer and bladder cancer as well. Then polycyclic aromatic hydrocarbons like benzopyrene are going to cause lung and bladder cancer. So the question asked was actually based on this benzene, okay. So benzene is going to cause acute myeloid leukemia, while benzidine, which is an aromatic amine, is going to cause bladder cancer. So both the options were given. So the question was on benzene. Then benzopyrene, which is a polycyclic aromatic hydrocarbon, can cause both bladder and lung cancer, okay. Then radiation carcinogenesis. So we have two types of radiation. One is UV radiation and another one is infrared radiation. So under UV radiation, we have three types of rays: UVA rays, UVB rays, and UVC rays. So B is the one which is going to cause us cancer. So UVB, B for bad, okay. So UVB rays are going to cause skin cancers, especially basal cell carcinoma, okay. UV rays for skin cancer causing basal cell carcinoma, while infrared rays, especially alpha rays, gamma rays, and X-rays, they are going to most commonly cause blood cancers like acute myeloid leukemia. So leukemias are common with infrared radiations. And in thyroid, if you see, infrared radiations can specifically cause papillary carcinoma of thyroid. So papillary carcinoma of thyroid, important risk factor is radiation exposure. Then microbial carcinogenesis. So various microbes have been implicated in the pathogenesis of cancers. So under bacterial causes, we have H. pylori, Helicobacter pylori. This is going to have the CAG-A gene, which is going to cause the cancer. So H. pylori is involved in causing chronic gastritis as well and peptic ulcer disease, right? So it is going to cause a inflammation. Chronic inflammation is going to be there, which is a promoting factor. So this is going to also result in cancer directly. So this H. pylori is going to result in gastric adenocarcinomas as well as gastric maltoma. Okay. Then coming to viral causes, we have RNA viruses and DNA viruses. So under RNA viruses, we are going to have HCV and HTLV1. So HCV is going to, it is hepatitis virus, right? Hepatitis C. So HCV virus is going to have a core protein, HCV core protein, which is responsible for causing hepatocellular carcinoma. And HTLV1, it is a retrovirus basically like HIV, and it is going to cause adult T cell leukemia. ATCL, adult T cell leukemia, and it is going to affect the CD4 positive T cells. So this is going to have two genes, TAX gene and the HBZ gene, which is going to affect the CD4 positive T cells, converting them into leukemia. So usually the exposure to this virus, after that it will take around 40 years plus to develop into a leukemia. So a very long latent period is going to be there, and its transmission is going to be via sexual or a parental transmission. So coming to DNA viruses, we have many DNA viruses. So first one will be the HBV or hepatitis B virus. So because of the HBX protein which is expressed by it, it is going to result in the hepatocellular carcinoma here. Then HHV8 virus, which is going to lead to Kaposi sarcoma and also primary effusion lymphoma. Okay, primary effusion lymphoma and Kaposi sarcoma is caused by HHV8. While HPV, human papilloma virus, it is going to be of two types, low risk genotypes and then the high risk strains. So the low risk subtypes are HPV 6 and 11, while high risk subtypes are going to be HPV 16 and 18. So the low risk subtypes are going to produce warts called as condyloma acuminatum. So, condyloma acuminatum, these are warty growths caused by low-risk HPV, while high-risk HPV, because of their E6 and E7 protein, which is inactivating the P53 and the RB genes, they are going to cause multiple cancers, especially cervical cancer, anal cancers, penile cancers, vulval cancers, and nowadays, laryngeal cancers, oropharyngeal cancers, especially oropharyngeal cancers in the tonsillar region. So oropharyngeal cancers, and also sometimes esophageal cancers as well when the HPV is going to be endemic in those areas. Okay, so these are all the cancers caused by high risk HPV. Then Merkel cell polyoma virus, this again as the name suggests, it is going to cause Merkel cell carcinoma. Then we have Epstein-Barr virus. So here Epstein-Barr virus is going to express LMP, which is a membrane protein, then EBNA protein, then interleukin, viral interleukin 10. So all of these proteins are responsible for the carcinogenesis. So EBV virus is being implicated in the pathogenesis of many cancers, especially Burkitt lymphoma, Hodgkin's lymphoma, certain subtypes, then nasopharyngeal carcinoma in China. Okay, now nasopharyngeal carcinoma is going to be common in the Asian countries. So nasopharyngeal carcinomas, and also post-transplant lymphomas. So after any transplantation, if they develop lymphoma, it is usually due to a Epstein-Barr virus. Okay, so these are the cancers caused by Epstein-Barr virus. Apart from that, Epstein-Barr virus is going to cause a infectious mononucleosis. It is just a fever condition. So this infectious mononucleosis is caused by Epstein-Barr virus, and Epstein-Barr virus is going to infect the B cells, causing a polyclonal B cell activation. So they enter the B cell via the complement receptor 2, which is the CD21 receptor. Again, we saw this in immunity chapter, right? So this disease, infectious mononucleosis, is also called as kissing disease or glandular fever. Okay, and in the peripheral smear of this infectious mononucleosis, if you see, we are going to have some atypical lymphocytes which are given a special name called as Downey cells. And the test, we can use the Paul Bunel test, which uses the heterophile antibodies to detect this infectious mononucleosis. So now we had seen about the DNA viruses. Next we will see about the fungus. So Aspergillus flavus, which is a fungus, it is going to produce an aflatoxin. So this aflatoxin can result in hepatocellular carcinoma. So aflatoxin is for hepatocellular carcinoma. Then parasites. So aflatoxin was also a indirect acting carcinogen. Under the examples, you must have studied that. So it is going to cause hepatocellular carcinoma. So under parasites, we have Schistosoma hematobium. It is a parasite going to cause the squamous cell carcinoma of urinary bladder. So in bladder, it is usually transitional cell carcinomas, but when the Schistosoma hematobium is there, it is going to cause squamous cell carcinoma of the urinary bladder. Then Clonorchis sinensis and Opisthorchis sinensis, both of these parasites are going to cause cholangio. These are flukes, they are going to cause cholangiocarcinomas. So all these are going to be direct one-liners examples.